Hey, what's going on everyone? Justin Lee here. Today is a special day because we're gonna start a new separate series called Student Speaks. Now, if you're a pre-physical therapy student, this video and this series is gonna be huge for you because let me tell you really quick what this is gonna be about. So Student Speaks is a series where different DPT students talk about their program. Now, why is this huge for you? Because if you're a pre-physical therapy student, you're probably wondering which program is good, first off, and how do I get in? And then secondly, if you do get in and you have choices, which one is the right fit for me? And if you look online and look at the websites of all these DPT programs that you apply to, you probably found like, okay, like they're good at ortho, they're good at neuro, they have community service, and then they have staged photos of people smiling and taking some goniometry measurements, and you're like, these people are so fake. Like, what is student life really supposed to be like? So Student Speaks is gonna be super convenient for you because different DPT students are gonna promote and talk about their specific program and to see if it's just the right fit for you. Because honestly, as much as I love APU, it's not a fit for everybody. And I understand when you're trying to choose and you're trying to see what student life is like, it's super important to make sure that you fit in because this is a 3-year commitment. So I hope the Student Speak series is super helpful for you. And if you find these videos to be beneficial, please feel free to share them. Also, calling out all current DPT students who are in school right now. If you want to share part of your experience or if you want to feature your school, please get in contact with me so that I can help promote your school as well. Okay, so in this series, episode 1, we have 5 different students that are going to be talking about their program. We have Justin Lee, of course me, from Azusa Pacific University from Azusa, California. Holly from the University of Miami from Miami, Florida. We have Gabby from High Point University from High Point, North Carolina. Brandon from the University of St. Augustine from San Marcos, California. And finally, we have Kiani from the University of Hartford in West Hartford, Connecticut. All right, so as you guys know, my name is Justin Lee and I'm a 3rd-year DPT student at Azusa Pacific University from Azusa, California. And if you don't know where that is, it's like near SoCal in between LA and Riverside, kind of near the mountains. So you get a big view of the mountains every time you go to school. And what's really cool about being in this particular area is that you can go surfing in the morning, you can go snowboarding in the middle of the day, and then you can go to Disneyland and watch the fireworks at night. So pretty prime location to be at, but anyway, that's just a setting. Let's get into talking about student life and academics and all that. All right, so student life and the relationships that you have with your professors is huge at APU. The professors are super in tune with all the students. They understand when they're going through stress, when things are a little bit more chill, and they are just so incredibly supportive of you. And you know, they're not there to fail you, but they are there to help lift you up and take you to that next level of your clinical reasoning, of just your maturity, and just you in general. Like, we have professors that show up for other students, our students show up for our professors, and it's just an amazing relationship that APU has constructed, and the theme or just the vibe that you get there is amazing. And if you guys have not seen my vlogs at all, go check them out because that will definitely speak for itself. All right, so a couple really big strengths about APU that I've gotten from just experience in this program is that their ortho is super strong. Like, when you leave APU, you're gonna be such a strong ortho clinician already as an entry-level PT. And I cannot emphasize this enough because a lot of students in the past have gone into their residency and fellowship, and a good number of students that apply get in. So the percentage, if you're gonna apply after graduating from APU, you're likely going to already have a leg up in your ortho and residency career because you are just set up so well for success. So just a plug, APU has a really strong relationship with the Kaiser system, And a lot of the Kaiser programs, at least here in SoCal, if you go to almost any Kaiser, you'll find that there is an Azusa Pacific alumni working there, and a lot of them are in the ortho setting. So if you apply and you're applying for that residency, they're gonna see that, oh hey, you went to APU, oh hey, I know that person, oh hey, da 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 da. You make a connection, strong networking, it's amazing. And along with that, the residency, when you move on, and if you decide to do the fellowship, game over. APU also has their own fellowship, which is called the Movement Science Fellowship, which is amazing. If you don't know them, you should definitely go follow them on Instagram. They have a ton of stuff with Kaiser residents, we have Kaiser fellows, you have Claire Frank, and a bunch of other people that, like, I'm always following them. I'm like, wow, I'm learning so much. APU is also known for educating in movement science, also known as MSI. And this is a concept that is fairly new. And some programs actually don't even teach this MSI concept, which is crazy because it gives you so many tools that you can just observe on just movement, how people are just moving in their dysfunction, some movement faults, and you're able to pick up things just by seeing, wow, how you squat or how you walk or things like that will help me drive onto what kind of impairments that you have. And that tool in itself is amazingly powerful because I don't even have to touch you and test certain things because I can already predict or highly assume that these are the things that you might be having issues with. Along with all that, our professors are freaking geniuses, and they created this app called PhysioU. And I'm gonna put the link below because this app is amazing. First off, everything you need to know in your textbook. You have your MMTs, your manual muscle tests, your measurements, all the things in ortho, neuro, all those different tests that you have to do is all in an app. I just want to emphasize how convenient this is. You don't need any textbooks. I haven't spent $1 on any textbook in my school. We go through all these apps that are research-based, and basically it is just a significant tool to have in my pocket, literally on my phone, that I can just check in an instant to be like, hey, well, how do I do that test again? What was the sensitivity? What was the specificity? Basically, if you don't know what that is, it's like the likeliness of some pathology to be ruled in or ruled out. And there's just all these descriptions on what the test is like, how it's done, and basically, and also referencing it on the bottom as well. So if you do not have this app, and if you're a pre-PT or a physical therapy student right now, you need to get this app right away. Okay, there is just so many things to brag about, but I just have a couple more things. Our passing rate for the licensing board is high. For the last couple years, we were nearly at 100% passing rate. So we're trying to continue that tradition. So I'm glad that I'm a part of a program that I know, like, all right, I have a likely, very high chance that I'm going to pass the boards already because my education is that good. And lastly, new and improved APU DPT program. We're going to have a new building to our school and is only designed for the DPT program. It's over a $3 million building. It's gonna have stadium seats. There's gonna be a large lounge area. Basically, there's gonna be a table in the front with video cameras on here and projection screens so that wherever you are, whether you're in the front or in the back, you'll be able to see the screens or in live on what exact skills, different angles, on how that looks like. I can't even imagine how great it's gonna be. They say it was supposed to be done already in February, and then they said March, and then April, blah, blah, blah. Forget it, but they said hopefully we're gonna have it by summer, but definitely in this year, 2019, they're gonna have it finished. So if you're a pre-PT student and you're gonna get into APU, you're gonna have that building, and it's brand new, baby. Okay, so enough about APU. Here are the other students. Check them out.
Hey guys, my name is Holly. I'm a third-year physical therapy student at the University of Miami, and I'm here to tell you some strengths about our program and why it was the best decision I ever made. First of all, the people are great. That's why I fell in love with the program, and I knew that I had to come here because on my interview, it was just everybody seemed to be so happy at the school and have such a balanced life, and yet be so knowledgeable about physical therapy, which has proven to be very true. The class size is 60 people, which is perfect to get to know everybody really well and have still individual time with the professors. Also, our professors are amazing and scholars in the field. And our curriculum really sets you up to be a great entry-level therapist and keep you open-minded about the different types of physical therapy that exist. You start out that summer with anatomy and you learn it backwards and forwards, which is super important. And then you get into the meat of the program after that with all of the classes. And we have high and low tables to practice all of your orthopedic skills. We have extensive neuro courses, pediatric, cardio, all the classes you need to know for inpatient or acute care. We really become great generalists, and there's different ways that you can find your niche in physical therapy. Like we have different electives. I'll just name a few because there's so many that you can take. Women's health, sports, taping, dry needling, and a really cool one we have available here is sailing. So if you choose to take it, you go out with quadriplegic or paraplegic people, and they basically teach you how to sail. They do the hard work, but you help transfer and you learn different things about that and their conditions. So that's something really you can only do here in beautiful Miami. You can see I'm standing in front of palm trees, and so that's another plus about it. We'll talk more about that later. And I want to talk about more of the program. So we have pro bono. So as a first year, you can even start going to the clinic and helping out and putting your skills to work right away, which helps really nail down the learning. And you're helping people out from the get-go, which is why a lot of us get into the profession in the first place. So that's a good thing. We're also one of the only schools that allow you to work with the teams. So we have a really great relationship with the football team and a lot of the other sports. So if you're interested in that, we have great avenues for getting into sports. So come to Miami for no matter what kind of physical therapy you want to do. We're going to get you there. You're going to have a balanced life. You're going to spend a lot of time in the clinic and really nailing down your skills and honing them in. So let me know if you have any questions about that. Give me a message. And as well as just if you like the warmth, Miami is a great place to live in because it's pretty much summer all year round. There's beaches everywhere, and you can travel to Key West, you can travel to the Bahamas, Disney World if you like that. It's everything is really close by in that sense. So lots of fun to be had as well. And go Canes!
Hey everyone, my name is Gabby Mace, and I am a first-year physical therapy student at High Point University in High Point, North Carolina, and I am a part of the second DPT class in the program. The first class started in 2017, and I will be graduating in 2021. So my class, there are 61 students, and I would say the average class size is 60. So a few things about High Point. One thing that really attracted me to this program was the pro bono clinic, and our program has a pro bono clinic that is off campus, and during your second year you actually take a class called community outreach, and you have the opportunity to go and treat patients at the pro bono clinic once a week all throughout your second year. And in addition to that, High Point also has amazing faculty, and that's one thing that I would say that is unique from other programs. All of our faculty have different specialties and interests, and they are leading experts and researchers in the field. And I would say that's one thing that really made me want to be here. And I just felt when I was at my interview, I belonged, and it was very conversational, and they just want to know you as a person and make sure that you fit the culture of our program. So another really cool thing about High Point is we actually start our clinical rotations in our first year. So your first clinical will be in your third semester of your first year PT school, and it will be 7 weeks long. And that was one thing that I really liked, being in clinic and getting exposure so early, and also being able to take musculoskeletal classes in your second semester, which is not a lot of programs do that. And I thought that was one thing that I really liked. And let's see, strengths of the program. There are some that I just named, but some other strengths are we have an amazing biomechanics lab. And I would say it's the best in the country. I mean, not to brag, but it's really amazing. And our faculty do research, and you actually, if you don't want to do research as a student, you are not obligated to, but we do utilize the lab in movement science, and you get to use some of the really high-tech equipment, which is awesome. And yeah, so that was a really cool aspect that we got to do first and second semester. So classroom education style, it is all in person, and so you're there Monday through Friday. We don't have any online classes, so it's all in person. And your first and second semesters, you have your full class, but in your third semester, like I mentioned earlier with having your clinical, they actually split the class in 30, so 30 are in class at the same time. So it's definitely more of a smaller class size, and you get to know your professors more, which I really like, and I really enjoy it. But just a few things about the High Point area. So the grad school is on campus, and it's separate than the undergrad buildings, but we also have a PA program and the pharmacy program that we share the building with. A little bit about the High Point area. It's a small town, but there are cities around it, such as Winston-Salem and Greensboro, so there are still places to go, and it's a really cool area. So I highly recommend that you check out High Point University's PT program. It is incredible, and if you have any questions, just let me know.
Hey guys, my name is Brandon. I'm a 6th term DPT student, and I'm here to tell you a little bit about my program. So I go to University of St. Augustine in San Marcos, California, and something that I feel like is very interesting that St. Augustine has is they have something called an ICP, so which is basically like a hospital setting where they have tubes, lines, and everything like that, so you can kind of simulate like an acute care. So they also have a ICU room where they have those monitors and everything that you could kind of simulate a patient and how you would take care of them, manage the lines and everything like that. So something else that we're doing is we're actually expanding our biomechanics lab. So right now we have an instrumented treadmill, and pretty soon we're going to have an instrumented walkway just built right into the ground. So then we're able to correctly diagnose the patient and see what they have, so they don't change their walking mechanics or anything like that. We also have a cadaver lab where we do all of our own dissections, which is very beneficial for us, so we can exactly know where the muscle attaches and all the fascia layers, and it's a very good learning experience in my opinion. So another thing our school has is we have tutors 5 days a week, so if you're not understanding a concept or just need a little bit more help on your schoolwork, they're able to kind of explain to you and help you out. You can actually also get a private tutor where the school pays for. You can set up Skype sessions or kind of email them or text them to see whether you're not understanding a concept or not. So going a little bit into the program, my class personally has 68 students. I know they're always adding more students each semester. Like I heard there's some 70s, and then now they're almost to the 80s, so it's a pretty big class size. We're an accelerated program, so we're on a trimesters, so we could go 8 trimesters instead of 3 years, so you can cut a little bit of time off, which is really good. Something that's interesting that University of St. Augustine has is we have a flex program where you can actually do all your classes online, just come in for your tests and lab skills and lab portions of it, but the only caveat is that it's going to take you 4 years instead of the 8 trimesters, which is a risk reward kind of thing. Something I really like about our school is we're really big on evidence-based practice and manual therapy, which is really good because we always want to be up to date with the most current research. All of our professors are clinical therapists, so they're all practicing physical therapy currently. Something that our school actually requires us to do is to go to a professional conference, whether it's state or national or even a student conclave, which is really good because we're able to see what's the upcoming new treatments, and we can kind of ease our way into the profession a little bit that way. So something that's good with the school too is the professors are very receptive to student input, just to see what are going well in the courses and what could be made better so the students will learn more, which is really good for learning for us. Something I feel like is very unique to University of St. Augustine is that from the very beginning they want to establish that interprofessional relationship with OTs. So we actually have some classes with the OTs to kind of establish, working together, and so we can help our patients in the long run. As far as location goes, you can't really beat it. You're only like 15 minutes away from the beach, less than an hour away from La Jolla, and less than an hour away from Disneyland, which is the happiest place on earth. And in between, there's a lot of breweries, wonderful places to eat, and yeah, it's pretty amazing over here. Overall, I enjoyed my time here at University of St. Augustine, and I definitely feel like it created some unique opportunities and learning moments that I only can get here. And yeah, I hope this information helped you decide where to go. Peace.
Hi, my name is Kiani Adams. I'm a student at the University of Hartford's Doctor of Physical Therapy program. Today I would like to talk to you guys about the strengths of our program. So the first strength, I think, is the small class size. My class is about 42 students with a 12-to-1 faculty ratio. Me personally, I really was considering the class size of the schools I was applying to when going through the application process. I always liked small groups. I always like to know my teachers, have a relationship with everybody I'm dealing with, and I feel like having a small class size really allows me to do that at UHart. And also, I don't really like to be just a number. I like my teachers to know me, and I like to be able to have discussions in small groups, and I just feel comfortable with a smaller class size than I would with a larger class size. So this was really a plus for me. The teaching style at UHart is traditional teaching style. So we have lectures. I know some PT schools use problem-based learning, but with us, we get the traditional lecture, we get the foundation information, and then we also use team-based learning, which is when we split into groups. So we work in the same groups throughout the semester, and we use the information that we got from the lecture that we got throughout the course of the semester, and we try to work as a group to solve a problem that might come up in a clinical setting or just a case scenario, and we just apply what we learned. So I think this is a great way to build your knowledge. You get to bounce ideas off your group members. You get to see things from different perspectives. So I think UHart does a great job of implementing the traditional lectures and the team-based learning. The curriculum at UHart is also a strength. I feel like each class serves a purpose and is a stepping stone for classes that you are going to take in the following semester. For example, in the summer, our first semester, we had anatomy and kinesiology, and I think this really set the tone for the following semester when we took biomechanics. So by taking kinesiology, I feel like we got the foundation that would help us be successful when it was time to take biomechanics. The anatomy class helped us become successful in orthopath, and orthopath helped us have the foundation to do well in musculoskeletal, which we're taking now in spring semester. Another good thing about our curriculum is that we have integrated clinical experiences. We go on these clinical experiences during the fall semester and spring semester. During fall semester, we have 6 visits in total. 3 are at an outpatient setting, 3 are in an inpatient setting. And basically, we go every Friday for a duration of 3 hours, and we observe and work with a physical therapist. And when we go on these clinical experiences, we have to make sure we are applying our skills. So we're giving a sheet, and it basically has a list of skills, list of things we've learned throughout the semester, and we give it to the therapist, and they make sure we meet these skills. So for example, we learned goniometry and manual muscle testing in our fall semester. So when we went on our clinical experiences, we made sure that we actually did these things with a patient. So I think this is really good, a really good way to get your feet wet and kind of not be like a deer in headlights when you go on your first full-time clinical. It also helps you stay motivated because I know just hitting the books all the time kind of gets boring. You kind of lose focus because you're not really applying what you're learning. You're just studying from a book. I feel like when you go on integrated clinical experiences, you see the patients and you get excited. You're like, this is what I want to do for the rest of my career. And it kind of keeps you motivated. It kind of keeps you wanting to do school. Like, school doesn't just feel like school anymore. You're kind of reminded of why you want to do it, and you're kind of reminded of the end goal. In the spring semester, the semester before you go in your full-time clinical, we have integrated clinical experience number 2, which is basically the same thing as integrated clinical experience in the fall semester, but now we're at one setting, either inpatient or outpatient, and you go there for 10 visits during the semester, and we still get a competency form where we have to get checked off on skills that we learned throughout the semester. And what's really cool about UHeart's program when it comes to integrated clinical experience number 2 is that you can do something called ICE to full-time, which is integrated clinical experience to full-time clinical, which is basically you choose a clinical that you want to go to for your full-time, and you can do your integrated clinical experience at that same clinic with the same therapist. I'm actually doing that for mine because I like the idea of being familiar with my therapist before summertime even comes. I know how he or she may work or teach, and he or she knows how I like to learn. So I think this is great for building your relationship with your CI before you even get to your summer clinical. And if you're the type of person like me who likes familiarity, well, I can't pronounce it, like comfortability, you like to know what you're getting into, and you like to be used to things, I think this is great because you don't really have to transition from one clinic to another, especially during your full-time clinical. This might be very nerve-wracking. So I wanted to eliminate all that. I did the ICE to full-time, so the clinic I'm doing my ICE number 2 at now, I will be there in the summer full-time with the same CI. Lastly, another strength of the program is the faculty. The faculty is very helping. They help you with everything you need. As long as you ask questions, they're there to help. Another thing I do like is the fact that there's a lot of students who graduated from University of Hartford who come back and teach, and I feel like this really enhances the teaching at UHeart because some of the older teachers may not be able to relate to us as students, and coming from somebody who just graduated from the program, students might be more receptive. And I feel like it kind of keeps you motivated because there's times during PT you think that you may not make it through the program, and then you see somebody who just graduated from the program come back and do it. So it's like, if they can do it, why can't I? And I think it kind of keeps you on your feet, keep you motivated, and it's just a great learning environment.
Alright, you guys, so I hope you got a lot of insights from the other students. Please feel free to comment below if you have any questions, and those questions can definitely be relayed over to those students. But if you are a current DPT student right now, first year, second year, third year, whatever it is, please get in contact with me because your voice matters, and when you speak up and talk about your program, students that are coming in who have applied to your school can have a better understanding of what student life is like, and so that maybe it can just be enough for them to make the decision to go into your program because it would be a right fit. All right, thank you everyone for tuning in. I really appreciate all your support to help Live for Change and this program grow. Feel free to share this video if you found any of this to be helpful. If you have a friend who has applied to one of the students in this video, share it with them please, because it does matter. All right, you guys, have a great one. Thank you very much.